People with mood disorders or mental illness can struggle during the best of times, and this definitely hasn't been the best of times. For the Colson Center, I'm John Stonestreet. This is Breakpoint. From the start of the COVID-19 pandemic, experts warned us of its impact on people with mental illnesses. For those with mood disorders, the pandemic packed a 1-2 punch. The depression and anxiety caused by the fear of contracting the coronavirus itself, and the depression and anxiety accelerated by measures taken to combat the spread of the coronavirus. Even the wide use of the term social distancing instead of the more accurate physical distancing communicated isolation and loneliness. Add to that all the canceled appointments with psychiatrists and other mental health professionals, and we should expect a steep decline in mental health. And that seems to be exactly what happened. A recent Census Bureau survey of 42,000 adults found 24% of respondents showed clinical signs of severe depression. 30% showed signs of anxiety. According to the study, the rate of anxiety and depression were highest among young adults, women, and the poor. Now, to put those numbers in better context, basically half of American adults said that they had felt depressed during this pandemic. Only a quarter reported similar feelings in a survey done 6 years ago. Things could even be worse than this survey, which was conducted between May 7th and May 12th. After all, 3 more weeks of social isolation and disruption probably didn't make things better. As the Washington Post said, the results reflect a deepening of existing trends, such as rising depression, stress, and suicide, especially among young adults. Writers in the Journal of the American Medical Association call the combination of COVID-19 factors with already existing suicide mortality trends, quote, a perfect storm. Well, perhaps it might be a while before we can say with any certainty if and just how COVID-19 affected suicide rates. What we do know is that COVID-19 is attacking a nation that's already emotionally and mentally fragile. This national fragility is, as we often say of other things, downstream from the rest of culture. Some of what makes people depressed and anxious is biology, but much of it also has to do with how we're made to live. As one doctor put it, riffing on John F. Kennedy's inaugural address, we should ask not what's inside our heads, but instead we should ask what our heads are inside of. Now, the most obvious example is loneliness, something we've repeatedly discussed in previous Breakpoint commentaries. Societies like ours are, by most accounts, loneliness-producing machines. Our deeply rooted sense of individualism is only made worse by our growing preference for virtual relationships instead of face-to-face ones. Add that to the fact that for many, upward economic mobility requires severing ties from those people and communities that gave us our sense of belonging, purpose, and security, and it just gets worse. On average, the number of close friends Americans have, confidants with whom to discuss important matters, went from about 3 in 1985 to just 1 in 2006. Now, it's difficult to guess what that number might be at the beginning of 2020. With social isolation, and as the Journal put it, decreased access to the community and religious support we do have, the phrase perfect storm is less a cliche and more a reality. This is a part of the plague that Christians, of all people, should be running into. Reaching out to the hurting among us doesn't require state permission, and we have the means to keep physical distancing from becoming social isolation. Part of this includes educating ourselves about signs of depression and steps we can take to help those who are struggling. There's no shortage of educational resources online. And not only should we pray for those people that are hurting, but we can tell them that we're praying for them. Now, to be sure, this pandemic will pass. When it does, and we begin to move all about the country again, it's going to be easy to once again forget the hurting and the lonely. We must not. God help us be people who won't forget. For Breakpoint, I'm John Stonestreet.